Well, welcome to this evening's webinar that we have tonight. My name's Andrew, and I'm here with the privilege of introducing Dr. Jeff, who's going to give us a bit of an overview on the GLP-1 and particularly men's hormones. Now, I'm pretty lucky. We've had a bit of a chat with Dr. Jeff, and he's an absolute wealth of knowledge. Being his background, I'll get him to cover off in a minute. But yeah, we're going to go through GLP-1 and what it specifically does in men and men's health and men's hormones. So welcome, Dr. Jeff. Thanks so much for jumping on after a couple of days of us trying to link up. We got there in the end.
It's been a rough couple of days. My wife and I are taking kind of a little family trip, and so we've been busy the last couple of days. But I wanted to make sure I could find time to fit you in. And we were at a conference, and we had really bad cell service, so I thought I was going to be able to do the meeting from there last night, and it's like, yeah, the cell service is so bad, we'll never get through it. And so I figured I'd postpone it so I knew I had time to talk to you and get through the entire interview.
Oh, that's fantastic. Well, I really appreciate you giving up your time. I know you're busy.
I'm really excited. I'm really happy that you invited me. I think it's so fascinating that, we can have this interview and you're on the other side of the world. I guess we figured out that it's 16 hours between us. So
yeah.
Yeah, I'm honored that you invited me.
Oh, well, thank you. I think given your background, you're the perfect person to have a bit of a chat about this from a men's health perspective, particularly with what you've shared with me and in your journey so far as a doctor. So I think we'll start off first with what's your background, Dr. Jeff?
So board certified in orthopedic surgery of all things, and I did conventional orthopedics for a long time, up until about 2009. And 2009, I really got kind of upset with the entire American healthcare system. It was getting to the point that patients, we really weren't taking care of their needs the best way we could. Everything was pretty much following what big pharma wanted us to do, following what the insurance companies wanted us to do. And it really wasn't what was best for the patient. And at that point, I was already starting to research and experiment with things like stem cells and platelet-rich plasma to help regenerate tissue instead of replacing it with metal and plastic, which is the way we've done it for years and years and years. And so I decided to switch over to that type of orthopedic medicine, regenerative orthopedics. And as I got into that, it just led very nicely to weight loss and men's hormones and women's hormones and menopause and everything, where we were really helping with health and wellness. I make the comment all the time here in the United States, we really don't have a healthcare system. We have a sick care system, which means if you go into the doctor and you have an illness, he'll write you a prescription for it, but nobody ever comments like, how do we get you better? It's not like, oh, you have high blood pressure, so you should cut out your salt, you should lose some weight, you should exercise more. It's, oh, here's my prescription pad, I'll write you a prescription, take it to the pharmacy and get it filled. It'll take care of your high blood pressure. But that's not treating the patient. That's, putting a Band-Aid on the symptoms. So I really started focusing on really how to help people. And when I was invited back in July to join LifeVantage, I knew it was a perfect fit because I knew this was something that would fit into my style of practice and would really help people.
Yeah, that's really great because at the end of the day, as you say, most of it's a Band-Aid. It's not actually getting to the root cause.
No, it's all a Band-Aid.
So yeah, totally understand that. Well, that leads us into the first question, I suppose. So in layman's terms, because not everybody understands medical jargon, what is GLP-1?
Yeah,
which is what we're talking about.
So the name itself, GLP-1, is glucagon-like peptide 1. So that's not even layman's terms yet. But so glucagon is kind of anti-insulin. So what happens is we eat food, the food has glucose or sugar in it. And when that happens, we have an increase in insulin levels. And as we push the glucose into the bloodstream so we can use it as energy, the insulin levels fall. And what will happen is glucagon levels will then rise. They're kind of opposite each other. And glucagon-like peptide, or GLP-1, it looks like the body recognizes it as glucagon. So glucagon causes increased hunger, increased cravings. But if you have GLP-1 working naturally in your system, it's going to block some of that. So it's going to allow you to not have really strong cravings and not get really, really hungry where you'll eat anything. So it kind of modulates that response. And so that's how this GLP-1 works. But the problem is because of our diets and things like that, and even regular aging, we start dropping off our production of GLP-1. And so that's where we get into the problem where GLP-1 needs to be replaced. And, we have the prescription drugs replacing it, but that's just, once again, a Band-Aid. It's not treating the system. It's just giving you an artificial form of GLP-1, which actually does the exact opposite of what you want it to do. It shuts your body system off. If the body says, hey, we're getting an outside source through a shot, we don't need to make any. We can just turn the factory off and let it depend on the shots. The Mind Body GLP-1 system is completely different than that. It's giving the body the building blocks to build its own GLP-1 up and get those levels back to normal again.
That's fantastic. And that's a really good overview and an explanation. And I guess it also covers off my next question, which is why do we need GLP-1 and the consequences of not having it function in our bodies correctly? So I suppose that second part of that question is, if we don't have GLP-1 functioning correctly, what are the health risks or health issues?
There's several. I mean, diabetes is probably the first one. I mean, what's going to end up happening is if you do not have GLP-1, then you're going to start responding to things like cravings. And so you're going to eat more. And what happens is there's a lot of things that can lower GLP-1. And one of the things that really works against us kind of in our whole healthcare journey is most of our diets, and I'm sure the diet over there is not much different than the American diet. We eat so much highly processed foods. And if we eat highly processed food, what it does is it actually turns off our hormones that we need for metabolism. So it turns off testosterone, and it turns off human growth hormone. It turns off thyroxine. So then what happens is with those hormones being turned off, or what I call down-regulated, now your weight starts creeping up. So as your weight starts creeping up, then you have increased what we call oxidative stress. Oxidative stress then once again down regulates those hormones, including GLP-1. So now you're not metabolizing your food, your energy, your GLP-1 levels are going down. So then you start putting on more weight. More weight you put on, the more you downregulate GLP-1. So it becomes a vicious cycle, and you can't get rid of it. And that's what leads to obesity.
Yeah, and then obesity leads to, as we know, so many different health risks.
Heart disease and early death and things like that. And the interesting thing is that as we do more and more research on GLP-1, it's not just a digestive issue. That we found out now that there's GLP-1 receptors in the heart. So if we have normal circulating levels of GLP-1, then it protects the heart. Same thing in the kidneys. We have normal GLP-1 levels circulating through the bloodstream. It protects the kidneys. And then the big one is we know that there's GLP-1 receptors in the brain. And those GLP-1 receptors in the brain are actually very interesting because they're right by the pleasure center. So when we have normal GLP-1 levels, they go to this pleasure center in the brain and they say, well, you don't need cravings. You don't need that sugar. My addiction before, and I've been on the Mind Body system since the 12th of October, and I'm down, as of this morning, I'm down 43 pounds.
Wow. That's fabulous.
So there's no doubt it works. And like we were talking about before, I played American football. I've always been a big guy. When I played football back in the late 80s, my playing weight was between 260 and 270. And that's about where my weight is now. It's proportioned a lot differently, but it's about where my weight is. And so I've
Yeah.
always been a big guy, but as I got older and exercised less, a lot more has turned into fat and a lot less muscle. So I still need to take some off. And really, my comfortable weight is around 220. So
Yeah.
I'm working back down to that level. But what happens is we start getting these when GLP-1 levels are low circulating in the body, we start getting these cravings. And my craving was Oreos.
Ah, really?
Oreos happen to be one of the few cookies that do not have dairy in them. And our son has a dairy allergy. Like if he eats dairy, his throat swells shut, his eyes swell shut. It's not like an
Yeah.
intolerance where he gets a little stomach distress. He actually has an allergic reaction. So we've always had Oreos in the house. And I'd walk past the pantry and I could hear him calling my name. It's like, you need a couple Oreos. And so I'd go in and grab two, but then 3 or 4 hours later, I'd grab two more. And 3 or 4 hours later, I'd grab two more. And then,
Yeah.
3 or 4 months later, you're up 20 pounds. So
Yeah.
I can honestly say that the one thing about GLP-1, especially with the pleasure center in the brain, is it stops those sugar cravings. It just knocks them out. And when we did the study before we released it in the US, it said that 92% of the people that were in that Club 55, which was the first part of the study, 92% had decreased sugar cravings. And that was one of the
That's
first things that I noticed is they're completely gone. And now I think that people are picking up on it in the research side because they're starting to use the prescription GLP-1s. Although I just had a doctor talk to me about, she wanted to add it into her practice. She does addiction medicine and she's finding that it works for drug addiction, alcohol addiction, tobacco, nicotine
okay.
addiction. So they're using the GLP-1s because it's down regulating that pleasure center in the brain. So it's,
Wow, that's exciting.
we talk about it for weight loss and things, but there's receptors all throughout the body that are going to really have some beneficial effects. And I think ours are going to have the same beneficial effects with the mind body system that we're seeing and the beneficial side of the effects in the injectable drugs. The bad thing about the injectable drugs is the side effects are
Yeah.
so bad because we're turning our system off and depending on the synthetic big pharma drugs. So we're seeing a lot of gastrointestinal side effects. We're seeing a lot of constipation and diarrhea and nausea, vomiting, esophageal reflux, and all of those, and muscle loss is the other big one. We're seeing all those with the injectables that we didn't see with the mind body system.
It's interesting. I'll just comment sideways there a bit on that. My wife, as I said to you before, she's disabled and she's been on a whole cocktail of drugs and also injectables. I think she's actually suffered. When you look at her physically, her body, she has lost so much muscle mass from particularly her legs, and I think that's been caused by. But
Yeah.
the other interesting thing that's come from these injectables that you're talking about is her gastroenterologist. He will not recommend the synthetic injectables for GLP-1. He believes they will cause down the track some very long-term issues with stomachs.
And
So
we're starting to see it here in the US. There's one of the big law firms here in the US has just put out kind of a class action suit. If you've had any of these problems from the GLP-1 drugs, give us a call and we're going to, fight the battle for you. So it's definitely happening. We see a lot of gallbladder law. I mean, a lot of people losing their gallbladders on the injectables and and problems where their stomach just stops moving food through it all, something called gastroparesis. And so we're seeing these bad side effects. And
that's exactly what our
the problem is here in the US, and it's probably the same problem over there, is that, once some of the big Hollywood stars get on these drugs and they talk about how great they are and how great they feel and how much weight they've lost, then everybody wants to be on them. And nobody's looking at the safety record. They're looking at, what,
yeah.
Kim Kardashian is saying about it.
Yeah. And now for our Australian and New Zealand friends on this call, Dr. Jeff's lost 20 kilos, so that's pretty substantial amount. So
Yeah,
congratulations on that. I've been
thank
on the
you.
system now for about 11 weeks, I think,
Hmm.
and even though I've lost about 4 or 5 kilos, it's where it's shown up for me is the around the measurements. Like
Hmm.
I dropped, I think it was 6 or 7 that is off my waist.
Yeah, and so that's interesting
So
because
yeah,
one of the things that they showed in that original 12-week study is that there's about a 27% loss in visceral fat in 12 weeks. Now, visceral fat is the fat that is around the organs. It's the fat that's around your intestines, and but it's also the
mm,
fat that's around your heart. So it's the fat that is more lethal
yeah,
because if it gets around your heart, that leads to heart disease and leads to heart attacks and can lead to death. So there was a 27% loss in that visceral fat. And when I was in Kansas City at the launch, they put that slide up on the front of the convention center, and I was sitting in the audience and I read that. It immediately triggered like a response, and it's like, well, if it's 27%, what is it with the prescription drug? So obviously, I had my phone, I pulled it out and Googled it. On the prescription drugs, it's only about 7% loss, 7 to 13% loss in visceral fat. So it's anywhere from 3 to 4 times better than even the prescription drugs. So, I mean, that's life-saving.
and we're natural, so that's really great. From a men or male perspective and their hormones, how would men benefit from increasing their GLP-1?
Yeah, so and that's a great question, and I think you're probably maybe the one of the first ones to ask me, kind of more specific on what happens in men and what we're seeing in kind of the whole spectrum of putting on. It doesn't even have to be obesity, but weight gain in men as we age. What we're seeing is as we gain more weight, we really, and I think most of it is based on the high processed foods that we eat. And I think, most of us that are busy and we have a career and we're on the go, and we probably don't eat as good as we should, and that highly processed food is going to start down regulating the hormones that we need, especially in men, testosterone. And in our practice, we're really starting to see low testosterone levels even in the 20s and 30s, which is pretty abnormal. We didn't see that even 20
Yeah,
years ago. And, I think it's all related to what we eat. And so as we increase our GLP-1 levels, that's going to take the weight off, which is it's going to rebound those hormones. So our human growth hormone is going to go up. So we're going to maintain strength. We're going to maintain muscle. But our testosterone levels are going to go up, and our testosterone levels, less daytime sleepiness, better sex drive, better libido, just making us feel like men again. And it's interesting. They've even done a study very
yeah,
recently
yeah,
that looks at it increases fertility in men. So you can be on. They're using GLP-1 in some families that have infertility issues, and they're finding out that in men, it actually will increase
geez,
sperm production and increase sperm motility. So it can actually lead to increased fertility. So which is an amazing thing that I think a lot of people didn't realize until just recently.
that's fantastic. What would be the long-term benefits of increasing GLP-1 in men and their hormones and their longevity for health? So, in some aspects, you've just covered that
Yeah,
off, which I
yeah,
think
I
is
think
is pretty good because most men I know are working really, really hard, and as you've just covered, their life is busy, and then I think their health takes a fairly substantial back step, and and they pay for it at the later part of their life. So, I think this has been
Yeah, I absolutely agree. I think that, we are so driven, and one of the things that you said when we first started talking to is family first. And I think, a good, a good man and a family man, and we're always going to put our families first. And sometimes we put our families first before we even put our own health first. And because of that, we end up kind of burning the candle at both ends, working longer than we want to, not eating as well as we'd like to. And because of that, we start decreasing the hormones that we need for our health and metabolism, and weight starts coming on and they decrease even more. And so I think the mind body system is one way that we can really start reversing that. And I think that, obviously if you pair that with Protandim to
Yep.
bring down the oxidative stress, now the oxidative stress is going to help bring those hormone levels back up as well. And we're going to get our bodies back where they're much finer tuned than they have been in a long time. And I think the same way in Australia and New Zealand is that LifeVantage is much more dominated by women. Same thing here in the United States. So usually I get more female questions. So I think on the men's side, we are seeing, I mean, it's really an epidemic of low testosterone in our country. And I think it's in any of the, more industrialized countries and richer countries. I think that it's a problem, and it's a problem because of our diets. I think as men work harder, we tend to eat out more, grab something quick for lunch, and a lot more processed foods, and really don't have the time to take care of ourselves. And I know you had mentioned when we first started talking, you said family first, and I think men try to do that. And I think putting family first means working hard and trying to make the best living we can for our family. And
Exactly.
because of that, we sacrifice our health
Correct.
as part of that. And so as we eat more processed foods, we downregulate testosterone. And as we downregulate testosterone, then we get sluggish and tired. And so even, when we come home at night, we're tired. We'd rather sit around, take a nap, watch the television, whatever. We just don't have that energy that we should have throughout the day. And, I think as we increase our GLP-1s and we we start decreasing the cravings for, processed food and high sugared foods. And we're going to start reversing the down regulation of our hormones. And with that, we're going to start feeling better.
No, that's exactly what I think we need, and it's interesting. Since I've been on Mind Body System GLP-1, it's the cravings for. I guess I'm a bit of a sugar person, or processed foods that involve sugar. And two things I've noticed since I've been on the system. One, I don't have those as much. So it's funny, I've dropped out sugar in coffee. And the second thing that I notice now also, which has taken probably 12 to 13 weeks, is the less need for food.
Mm-hmm.
That's really the obvious thing for me.
Yeah, and that's a great segue, because I think, one of the things that I think people don't realize, and I think it's important for those of us in LifeVantage to really teach our customers, is that this is not a fast solution.
No.
If we take the injectable prescription GLP-1, it's instant. You give the shot, your levels are high, and you can start losing weight. You also have all the bad side effects that are associated with that. But with the mind body system, you're trying to build your system back up. You're trying to build that level of natural GLP-1 back up, and it's not going to be overnight. And, the first 4 weeks, you're kind of resetting your body and you're resetting the system. So in the first 4 weeks, you might lose a pound or so. You start feeling better. Maybe the cravings are starting to come down, but it's not until that second 4 weeks that you really start getting the levels back up to normal. And then it's by that third month that now your levels are up where they should be, and you're going to start feeling the effects of less cravings, less hunger, and start seeing the weight come off. And with me, like I said, I'm down over 40 pounds. I've been on it about 5 months, but I lost most of my weight kind of in the last 2 months. In the first 3 months, it was slow. It was much slower going. But
Yeah.
once you get your levels normalized, that's where you start feeling good, and the weight starts coming off.
And I suppose that leads to an important question. This is going to be different journey for everyone because everyone's individual and it depends on where they're at. So some people will, if you're looking for a quick fix, this is not it.
Correct.
I teaching my customers that, you've got to stick with it. It's a bit like with Protandim. I tell people now,
Right.
you've got to give it 6 months. Doesn't matter
Mhm.
how old you are, you've got to give it at least 6 months because everybody's individual.
Right. Absolutely.
So leading on to another question, what would be the long-term benefits, and I think you covered off this a little bit, of increasing men's GLP-1, particularly around their hormones and I guess the longevity of health span for men?
Yeah. So, as I was alluding to earlier, the GLP-1 receptor sites where the hormone binds, all the focus initially had been on the GI tract. It's going to slow digestion. But, what we're seeing is that because there's GLP-1 receptors in the brain, it improves brain health. It's going to improve your ability to think. It's going to decrease those cravings because it affects the pleasure center of the brain. But there's GLP-1 receptors in the heart, and it's very well proven that it decreases your risk for heart disease. So decreasing your risk for heart disease is going to allow you to live longer and be around for your families longer. And then same thing with the kidneys. It's going to it's going to increase the protective nature to the kidneys. So I think the long-term benefits are significant. And then we also know that it decreases visceral fat, and visceral fat is one of the leading causes of heart disease in especially in men, because we get a lot more visceral fat than women do.
Yeah, well, it's interesting because the number one killer in Australia is heart disease.
And number one killer in America and the States as well.
Yeah, and I think that's because we're aligned
And
with our
and
food.
most of it's secondary to obesity.
Yeah. And the frustrating thing about a lot of this is it's all. I mean, my whole philosophy in life has been prevention, and that's come from my, I guess, military background where you be prepared, or even I was a Boy Scout, so the old motto for Boy Scouts was be prepared. So I've lived that philosophy all my life, and unfortunately now we've bombarded with media about quick fixes and this is how it's going to work, and anything good in life is not a quick fix. It takes
Correct.
time to do anything correctly and right, and if we can encourage men to pivot and get back on the track with better health, well, then that's prevention. Anything that leads away from having to rely on medication and other interventions in health practices, that's going to be a good thing.
Yeah, I have a Instagram page that I call the Dr. Jeff effect. And, part of that is taking your healthcare into your own hands. You can't depend on your doctors to do what's right for you. They're not trained to do that. They're trained to write a prescription if you have a problem, but really not deal in your health and well-being. And because of that fact, you just can't. I mean, and it sounds bad for me as a doctor to say this, but you can't trust your doctor to have your best interest in mind. He's going to do what he was taught to do, which is write a prescription. He's not going to help you really take your health and wellness into your own hands and do what's right for your longevity.
And that's a sad thing because they're only teaching to treat the symptom, not the root cause. And as we know, the root cause is coming from a combination of oxidative stress and aging. So,
And diet.
yeah. So the last question is, how is the newer GLP-1 Mind Body System going to assist men specifically and their health goals? Now, you've covered off some of this correctly, but already, but I think there's still men being men. How will it help them be men, I suppose, is my last question.
Mm-hmm. Yeah, I think it's something that we can be on long term. I don't think I think it's going to be almost a lifestyle change. I think we can start the mind body system, and as long as we can financially afford it, I think it's something that you can be on for the rest of your life, because it's going to protect your heart, it's going to protect your other organs, it's going to even work on your reproductive system. It's going to increase sperm count, increase sperm motility, potentially increase fertility, because we're seeing even problems with testosterone and fertility in younger men. So, I think that it's something that, if we can get on it in our early 30s, it's really going to change the way that men look at their own lives.
Yeah, that's exciting. Yes, I'm aware of fertility. Fertility is becoming a big issue, and in some men, yeah, definitely. So that's obviously attributed to low testosterone.
Low testosterone, and then also, increased weight and obesity decrease our fertility rates, both men and women.
Yeah.
Now, there's some interesting articles. If you go on a Google search and Google Ozempic babies, there are some really interesting stories about couples that have gone on the GLP-1s together, and have been infertile and have actually conceived children. And they talk about what the reasoning is behind that. So, some pretty interesting reading.
I can imagine. Oh, that's excellent. So, I guess that comes towards the end of our interview. It was supposed to be around 20 minutes. I think we've gone a bit longer than that, but it's certainly been absolutely fascinating talking with you and learning what your knowledge is around this, and specifically for men, because I think, like I said before, men take a bit of a backward step into the health. And I know, looking at my uncles, most of them worked hard, and I can see the the side effects from that now in their 70s and 80s. They're all big, large men carrying weight, and I guess my philosophy is to help people not go down that path. And I
Yeah,
think,
absolutely. I think it's important. I think that we've always been taught to do everything we can for our families, but I think part of that now is we've got to remember that if we don't take care of ourselves first, we're not going to be around to take care of our families later.
yeah,
And I think that's important to remember as a man, trying to
yeah.
raise a beautiful family. And we have to put our health first sometimes, and I don't think we do that.
And I think you're right. It's funny how we're raised to basically provide for the family as providers, and that's what we do. But yeah, we do put our health in the back step. But I do know, I've heard, female friends of mine, and they talk about their husbands and partners and how they, I wish he'd just look after himself a bit better, and they worry about, their health effects, and not necessarily from a provider point of view, but they're still part of the family. So,
Right, absolutely.
and I think it's important that men have, look after themselves as well.
Yeah, absolutely true.
Well, thanks so much, Dr. Jeff. What a fabulous time talking to you, and
Thank you for inviting me. It's been wonderful.
look forward to meeting you in April.
Yeah, we'll see you in April.